Hi, everybody. I tend to find that the universe gives you things in threes. In this case, it came in six, so doubles. Today, I want to talk about postpartum preeclampsia. So when you have high blood pressures in the postpartum period, when you're pregnant, your blood pressures are monitored for preeclampsia. You can also have these high blood pressures in the postpartum period. When you have really high blood pressures and you're pregnant, you'll often be induced. You might go to a C-section to really help with those blood pressures, right? We know too high a blood pressure can result in things like stroke. Preeclampsia is one of the most common causes of maternal mortality. So we really keep an eye on those blood pressures. But I've now seen 6 families where the mother was diagnosed with postpartum preeclampsia and put on medications. And why I want to talk to you about that today is because they were then not warned that those medications can delay your milk supply increasing. And it can also cause side effects in the baby of a sleepy, poor feeding baby. So what I want to talk to you about today is the side effects of those medications and really what you should have been told by your healthcare provider. So most common medications with postpartum preeclampsia are going to be beta blockers or anti-hypertensives. Most common ones I see are labetalol, nifedipine, Procardia. Every once in a while I'll see Coreg. But labetalol, nifedipine, and Procardia are the most common ones that I'm seeing. All of those medications are considered safe. Procardia, labetalol, nifedipine are considered L2s per Hale's medication in mother's milk. This is the textbook that Dr. Hale has written on every medication and its impact on breast milk. L2 is the same category as ibuprofen. It is considered safe to take while breastfeeding, but there can be side effects. And interestingly enough, the side effects for all of those medications is, when you look at the list, for baby, you're looking at drowsiness, lethargy, poor feeding, and reduced weight gain. And that's true for labetalol, drowsiness, lethargy, poor feeding, and weight gain. That's true for nifedipine. It's true for nifedipine, Procardia are the same medication. It's the calcium channel beta blockers. So the issue becomes if you had preeclampsia during pregnancy and then were induced at 37, 38 weeks, maybe 39 weeks, and then you're put on these medications for postpartum preeclampsia. These medications transfer very small amounts to the baby. Again, they are safe, but they can make for really sleepy babies. On top of 37-weekers, we know are the great pretenders. They tend to not feed well as late preterm babies anyway. 38-weekers are considered full term, but they can still take 3 to 4 weeks to become efficient breastfeeders, on top of the possible side effect of a sleepy baby who doesn't feed well because of the medication. So you're having these double whammies on top of each other. On top of the fact that if you're also given diuretics, and you're on these medications for reducing your blood pressures, that they can actually impact your milk supply. So what you really need to know is if you have postpartum preeclampsia and you're on medications for that, and you have a tiny baby, that can make your baby sleepy and not feed well and have an impact on your milk supply. So what does that mean? It means that your realistic expectation is that you most likely will be doing triple feeding, attempting to breastfeed, pumping, and supplementing until you can wean back or titrate back from those medications and until your baby gets bigger and stronger. So if you had a 37-week baby or a 38-week baby, even if you had no health concerns, it may take them 3 to 5 or even 6 weeks to really become efficient breastfeeders. They were born a little early. But then you add on top of this medications, again, your realistic expectation is it might take you a month to 6 weeks for your baby to become an efficient feeder. And you may need to be triple feeding or doing lots of extra pumping and stimulation in order to then help your milk supply increase. Do not get discouraged if you're on these medications and have a sleepy baby and you're not seeing much milk yet. It's going to come. When you titrate off of those medications, when your blood pressure has now regulated, when your baby is bigger and a more efficient feeder, the milk will come. Don't get discouraged at seeing really small amounts of milk while you're still taking lots of medications and you're dealing with your blood pressure. Milk is made from blood. So anything that affects your blood can have the potential to impact your milk supply. So the realistic expectation, if you have postpartum preeclampsia, if you're on medications for that, and you have a baby that's really under due date, it's going to take time. It'll take time until you wean off of those medications, until your blood pressures are regulated, for that baby to then become a more efficient feeder. They need time. They need time to mature. They need time to grow. And that those medications may be the cause of your low milk supply. And as you're able to wean those with your team, then you should be able to then see that milk supply increase. So I'm really sad. All of these families that I worked with, again, 6 families, 3s and 3s, 6 families that I worked with were never told that that could be a possibility. So they were like, I have this really sleepy baby. I'm not seeing much milk. What's going on? The education should be, you need this life-saving medication. We want to make sure that your body is healthy and that you're here for your baby. But the side effects can be delayed milk, increasing in volume, and a sleepy baby. Your baby, if they're born, again, 37, 38 weeks, is going to need until usually 2 weeks past their due date to become an efficient feeder anyway. So they just need some time to grow and mature and practice. So realistically, most families, when they're in this, need to be pumping to stimulate, even if they're not seeing very much milk in those bottles, and most likely also doing some supplementation of formula in order to get the baby fed, get them to that later stage. And then as they're weaning then of the medications, then we start to see baby become more perky at the breast. We're then seeing the milk supply increase. So if that was you, if you had postpartum preeclampsia, if you were on medications and you struggled with milk supply, you struggled with a sleepy baby, that's the why. And the realistic expectation is, if you're in the thick of it, just keep going. Get your lactation support. Make sure you're surrounded by a good team. Make sure you have a good quality pump with the right size flanges, because sometimes, again, if it's the medication causing the low milk supply, you still just need to keep stimulating your body to say, hey, I have a baby, keep making that milk. Hey, I have a baby, keep making that milk. So that as you wean down from the medication, you should then see that milk supply come up. And I've seen that happen now with families that I worked with last year where this was the case. They had the postpartum preeclampsia. They were able to bring in a full milk supply. I just had a mom the other day text me a picture of jugs of milk, and it was amazing, where she was pumping very little in those early days being on these medications. So thank you for joining me this morning for my live. Again, I just wanted to have that little spiel because it's happened too much to me this week to not talk about it. I want to make sure that you have better education and are understanding what's going on with you, your baby, and your body. We'll talk to you next time. Now you know.